Now, I'll be giving you the lowdown on all you need to know about multiple sclerosis, otherwise known as MS. I'll be talking about the causes, how do you know you have MS, symptoms, diagnosis, treatments, what works, what doesn't work, use of stem cells, cannabis, and by the end of this video, I expect you all to be experts in MS. Now, throughout the video, I'll be using the word multiple sclerosis and MS interchangeably. Now, MS is a neurological condition which is caused by damage to the myelin. Now, the myelin is the coating that protects the nerve fibers that's responsible for transmitting electrical signals from the brain and to other parts of the body. And so when the myelin is damaged, this leads to scarring or lesions in parts of the brain or the spinal cord, and so the nerve fibers are not as effective in transmitting the signals, or they're not able to transmit the signals at all. Now, you know that your immune system has a protective function of attacking any foreign agents such as viruses, bacteria, fungi, and destroys them. Now, what happens is that your immune system becomes faulty and thinks that the myelin is a foreign agent, and then by mistake attacks the myelin. So the word multiple sclerosis, multiple as in lesions which are scattered over the brain or the spinal cord, and sclerosis comes from scarring of the brain of the spinal cord. So what causes multiple sclerosis? Now, there is no known single cause for MS, and it's thought to be due to an interplay of genetic, environmental, and lifestyle factors. So far, there has been no specific gene that has been shown to be inherited for MS, but it has been found that there is an increased risk of MS if you have a first-degree relative, such as a parent or sibling with MS. The risk of MS is also increased due to factors such as viruses, where you might have Epstein-Barr virus, known as EBV, which is the cause of glandular fever, as well as the virus that causes measles. Another cause is smoking, whether it's active or passive smoking. So even if you're in a pub or a bar, just by inhaling somebody's smoke, you'll be classed as a smoker. It has also been found that low levels of vitamin D, especially in adulthood, is a risk factor for MS, as well as obesity in childhood and adulthood, and it's thought that the excess weight can lead to low vitamin D levels as well as inflammatory processes in the body. MS has been found to be quite common in temperate countries like England, Canada, the Scandinavian regions, whereas it's less common in countries closer to the equator where you have plenty of sunshine, where incidentally there is high exposure to vitamin D. Do remember that being obese or just having low vitamin D levels or just smoking does not mean, oh, I'm going to have MS. So there is much more at play here. As I said, there is an interplay of genetic, environmental, and lifestyle factors. Now let's talk about the symptoms of MS. MS can occur between the ages of 16 and 50, but is typically diagnosed between the ages of 20 to 40. I mean, symptoms can take minutes, it can take days to manifest, and these symptoms do tend to come and go. Now, MS has non-specific symptoms and depends on where the lesions are in the brain or in the spinal cord. And so to understand the symptoms better, I've decided to group them into body systems. So if we look at the eye, now MS causes a symptom called optic neuritis, where you have inflammation of the optic nerve, and it is one of the early signs and symptoms of MS. So basically, you can have symptoms such as blurry vision, temporary loss of vision in one eye, and pain on eye movement. Another symptom is double vision, where it can be the effects of MS on the brain as opposed to the optic nerve, which you get in optic neuritis. It's not usually noticeable, but if you're looking down or looking sideways, you might notice double vision. Double vision can also affect your balance and cause nausea and vertigo symptoms. Another eye symptom that is a characteristic feature of MS is called internuclear ophthalmopegia. For example, when looking to the left, the right eye keeps looking straight ahead. Now, MS can also affect the brainstem and the cerebellum. Now, the cerebellum is part of the brain that's responsible for coordinating movement and balance and has a part in vision and eye movement. So with this, you would expect difficulties with swallowing, speech, and ataxia is when you have unsteady walking gait, being clumsy with loss of balance, lack of muscle coordination, experiencing tremors, where you're so shaky that you're not able to hold a glass properly, as well as vertigo, where you have the sensation of the room spinning round. Now, one specific symptom to look out for is spasticity, where you have muscle stiffness and spasms. Here, the muscles feel so stiff that your fingers are actually quite difficult to move and slow to relax. Walking can be difficult, and with spasms, you can get uncontrolled twitching or jerking of the muscles. This means that you are at risk of having falls, losing your balance, and your sleep at night is also affected. MS can affect the bladder, where you get bladder symptoms such as urgency, where you feel the need to pee all the time. Then there's frequency, where you're actually going to the toilet all the time. And you also have incontinence symptoms, where you're experiencing leakage of your urine. Your MS can also affect your bowel, where you have bowel symptoms such as leakage of feces, constipation, and loose bowel motions. MS causes sexual problems such as erectile dysfunction in men, where you do not have an ability to hold or keep an erection for longer enough for satisfactory intercourse. In women, you would expect loss of libido, loss of sensation, reduced orgasm or sexual pleasure. And then you have other non-specific symptoms such as pain, where you have nerve pain or musculoskeletal pain, brain fog, where you have loss of memory and it takes a long time before you can even process thoughts and the words that you actually want to say. And fatigue is one of the main symptoms that most MS sufferers actually complain about, which is not your usual tiredness, but extreme tiredness where you cannot even get out of bed to do your daily activities. And it's the common reason where people are actually not able to continue with work. Then you have other symptoms such as tingling, where you might have a sensation of tingling going up one arm or leg, a burning sensation or itching sensation of the skin. Now, there are 3 important clues to know if you have MS. One clue, as I mentioned, was the internuclear ophthalmopegia, where basically if you're looking to the left, one eye is looking to the right. The second clue is called Lhemitte sign, where you have this electric shock-like sensation when you flex your neck downwards. Now, the third clue is called Uhtoff sign, where your symptoms actually get worse on exposure to heat. So for example, if you have a hot shower or hot water bath, you might notice that your symptoms are actually worse afterwards. Now, there's one important symptom to note called the MS hug. What is an MS hug? So an MS hug is when you experience this tightness, like a tight band around your chest or one side of your body, and it can be so discomforting that you find it difficult to actually breathe or painful to breathe. And it's thought to be due to spasms in the intercostal muscles as well as nerve-related pain. It can be quite a distressing symptom to experience because if you're having chest tightness or chest pain, the one condition that you're worried about is, am I having a heart attack? So being familiar with your symptoms is quite important because you need to know the difference between a heart attack or heart-related chest pain and an MS-related chest pain. And this symptom can actually cause extreme anxiety in a lot of MS sufferers who experience MS hug. Now, as I said, not everyone with MS gets all the symptoms that I've mentioned. Symptoms can vary from one person to another person, and it can also vary from day to day. So one day you might have tingling, and the next day you might have lack of muscle coordination. You have good days and you have bad days. Symptoms of MS are very unpredictable. Let's talk about the diagnosis of MS. How do I know I've got MS based on the symptoms? So diagnosis is based on 3 things. So I've mentioned the symptoms of MS. Now we also talk about the positive findings on examination, usually done by a doctor. And then the third is investigations such as an MRI of the brain and the spinal cord and lumbar puncture. So in terms of symptoms, we've talked about vision, speech problems, motor and sensory deficits such as tingling, bladder and bowel problems, problems with coordination, walking. With the examination, this involves a neurological assessment done by a doctor to assess your brain and your spinal cord. So they'll be looking at, for example, with optic neuritis or double vision, they'll be looking at, is there any pain on eye movements? Also looking for double vision, known as diplopia or nystagmus on eye movements as well. Then they'll be checking your coordination. Can you use your finger to touch your nose and to touch my finger? And then do that with the left hand as well. Or they might tell you to clap like this. Can you coordinate going back and forth with your palm? And the doctor would also check your reflexes with MS, check your balance in terms of your walking, as well as other findings that will present on a neurological assessment. Now, one of the main investigations to do is an MRI scan, which will visualize any lesions in space and time, whether it's in the brain or in the spinal cord. Now, the only problem of an MRI is that if you just have one lesion that shows up in MRI, one lesion is not enough to diagnose MS because you need more than one lesion. So this is why in some people, diagnosing MS using an MRI takes time because you either have to wait for another relapse or for another lesion to appear because you need evidence of lesions disseminated in space and time. So disseminated in time means that your relapse or the lesions have appeared at different times or dates, while disseminated in space means that you have one or more than 2 separate lesions in different parts of the central nervous system, whether it's in the brain or in the spinal cord. Now, in most cases, as I said, an MRI scan is not sufficient to diagnose MS, or they might just want to make double proof sure that this is MS. So usually they'll do a lumbar puncture. Now, a lumbar puncture is a needle that goes into the space between your discs so as to capture a small amount of fluid known as the cerebrospinal fluid, which I'll call the CSF. Now, this is looking for what we call oligoclonal bands. Now, these are antibodies that attack the myelin. As I explained earlier, your immune system thinks that the myelin is a foreign body and attacks it. So antibodies are produced as a result. So these antibodies are collected from the CSF and then they run through a process called electrophoresis, which is now looking for the presence of 2 or more bands in the CSF, which are called the oligoclonal bands. Now, oligoclonal bands are found in more than 80% of MS patients, and it's a sign of disease activity. Now, the aim of diagnosis is not just to confirm MS, but to rule out other causes or conditions that can present similar to MS. So your doctor would also want to do blood tests such as a thyroid test, HIV, tests for like vitamin deficiency, blood sugars for diabetes, and several other blood tests. Let's talk about the types of MS. Now, there are 4 main types of MS. You've got the clinical isolated syndrome, where basically you have one single episode of MS, which is not enough for a diagnosis because you now have to wait possibly many more years to have another single episode. However, if you have a scan and it shows more than 2 lesions, then it's most likely that you had MS, but just one episode, you'll be classed as having CIS, which is a clinical isolated syndrome. So you have one attack and you might not have another attack for the rest of your life. But in most cases, a CIS would then go on to become what we call relapsing-remitting MS. Now, relapsing-remitting MS is the most common form of MS in 85% of people. You can have a relapse where your symptoms are stable between each relapse, but your symptoms or disability gets worse after each relapse. So for example, it could be that you could walk with a stick, but after the next relapse, you now need to use a wheelchair. But you need to use a wheelchair until your next relapse. So your symptoms don't get worse while using a wheelchair until you have another relapse. And also, a relapse is now followed by what we call a partial or full recovery. Some people recover 100%, some people are 90 or 95%, so this is known as remission period. Relapsing-remitting MS can eventually lead to what we call secondary progressive MS, where you do not continue to recover like you previously did after each relapse, and progressively your disability starts to get worse. So what is a relapse? Some people refer to a relapse as having a flare-up or exacerbation or worsening of symptoms. So this is when you might have new symptoms or your existing symptoms appear at least more than 30 days after the last episode or relapse and lasting for more than 24 hours in the absence of any medical cause, such as maybe a fever or an infection, such as a UTI. For example, a UTI can present with pain on passing urine, urgency and frequency, which might be similar to what MS does to your bladder, which again is urine urgency, frequency. So it can be difficult to differentiate between, is this a UTI or is this a relapse of MS? So again, having a relapse affects everyone differently. It can range from mild to severe, where basically symptoms can last from days to weeks to months. So the other type of MS is called primary progressive MS, PPMS. Now this is found in between 10 to 15% of people with MS, where your symptoms actually get worse right from the start, despite not having any relapses or remission. So progressive means that your symptoms are actually progressing towards increasing disability. Now the third type of MS, or the fourth type, is the secondary progressive MS. So most people will start with relapsing-remitting MS, and then over time, despite not having any relapses or remissions, their disability starts to get worse. This can happen gradually or it can happen very quickly. This means that unlike in relapsing-remitting MS, where your symptoms get better, where you have the period of recovery after each relapse, you're no longer having those periods of recovery after each relapse. Now the problem here is that a lot of people are diagnosed as secondary progressive MS right from the start because initially you do not recognize what the symptoms of MS are. Like if you're having numbness or tingling, you're not thinking, oh, I've got MS. And also your doctor is not thinking this could be MS. They could be thinking this could be a vitamin B12 deficiency, folic acid deficiency, or even having that MS hug, which is one of the early sign of chest pain. They're thinking, oh, okay, we've ruled that heart condition, so maybe this is anxiety or musculoskeletal chest pain. So eventually a lot of patients or people end up being diagnosed as having secondary progressive MS right from the start. Let's talk about the treatments for MS. So there is no cure yet for MS. Treatments are aimed at relieving the symptoms, reducing the severity and frequency of relapses, and promoting tissue repair. So with treatment, we're looking at medications, therapies, alternative treatments, and self-management. Now, we'll talk about disease-modifying drugs. The aim of disease-modifying drugs, known as DMDs, is to reduce the severity and frequency of relapses and speed up the recovery after each relapse. They have been shown to be at least up to 80% effective, with fewer side effects depending on the strength of the drug. Now, there are about 20 DMDs used for MS, and they all come in different forms. So you have injections like your beta-ferron, you have infusions like natazolumab, and then you have your oral pills like dimethyl fumarate. Now, majority of these DMDs are licensed for relapsing-remitting MS. And then for primary progressive MS and secondary progressive MS, you've got one DMDs for both of them. Usually, when you start a disease-modifying drug, it can take 3 to 6 months to see the full effects of the treatment. So you have to be very patient with these medications. Also note that these drugs do not repair nerve damage, so they do not reverse your existing symptoms. So apart from treatments to reduce the frequency and severity of relapses, there are treatments to help you relieve the symptoms of MS. It is impossible to go over them in detail or cover them all, but there are drug and non-drug treatments. For optic neuritis, which is swelling or inflammation around the eye, you would usually be given a steroid, either as a tablet or as an infusion, though optic neuritis for many people can improve on its own after a few weeks without needing any treatment. For spasticity, which is muscle stiffness and spasms, baclofen is given as the first-line drug. This helps to improve mobility and reduce pain, which can sometimes occur with spasms. Other options are gabapentin, which can be given as a standalone drug or as a combination drug with baclofen if baclofen is not effective. I know there are now other options like pregabalin and carbamazepine as well. Botox injections can also be given into the muscles and its effect can last for up to 3 months. For pain relief, which is usually nerve pain or musculoskeletal related pain, you have again amitriptyline, pregabalin, gabapentin. Now, these medications can take weeks or months to work. They start with a low dose and they're dose titrated until you get to a dose where it relieves your symptoms. As you know, with these sort of drugs, you get side effects like amitriptyline. You could have dry mouth, constipation, drowsiness. With your gabapentins and your pregabalins, they can make you a bit woozy. Some people complain of brain fog symptoms, memory loss, hallucinations, just because they act on the brain pathways. For bladder symptoms such as urine frequency and incontinence, there are the options of medications like oxybutynin, amitriptyline, and intermittent self-catheterization. If you have bowel symptoms such as constipation, you'll be expected to have stool softeners or laxatives, and you're encouraged to go on a high-fiber diet. For erectile dysfunction in men, we're looking at tablets like Cialis, sildenafil, also known as Viagra, injections, or vacuum pumps. If you're experiencing seizures, your doctor would usually give you anti-epileptic drugs to help control the seizures. For fatigue, off-licensed drugs are given such as your amantadine, modafinil, as well as SSRI drugs have been shown to help with fatigue, but any drugs are usually combined with non-drug treatments such as pacing yourself, making sure you have rest breaks, and any other drug treatments to help with fatigue. Now, physiotherapy is very, very important for people with MS. These are the guys that are going to help you with your muscle coordination, with any tremors, with your walking, your balance, pain, fatigue, as well as giving you a comprehensive exercise rehabilitation program that is going to help you manage your symptoms. Then you have occupational therapy, which come to your home to give you adaptations, such as a stair lift if you have a stairs. If you're someone who has to work, they would make your home a good working environment where they might actually have to move your bedroom downstairs, looking at adaptations for your bathroom, where basically you cannot lift your leg to go into the bathtub, so you now need an adaptive shower. Then you have speech and language therapy to help with speech. One thing not to ignore with symptoms of MS is the mental health aspect. Anxiety and depression is something that you can get with MS. So cognitive behavioral therapy helps with anxiety, depression, fatigue, pain, while psychosexual counseling can also help for sexual problems that are affecting both men and women, while some people find that they need to actually go on antidepressants to help with the anxiety and depression symptoms. And for those not keen on drug treatments, there are also alternative therapies such as relaxation techniques, acupuncture, Pilates, which is good for muscle strengthening, and other self-management courses that are run by professionals and even people who have suffered with MS and have a good knowledge background of how to manage their MS symptoms. Now, if you have a relapse, how do you treat a relapse of MS? Now, steroids are the mainstay of treatment for relapses and usually have to be given within 40 days of the onset of the relapse. So a doctor would usually give you a high dose of a 500 milligram oral methylprednisolone for 5 days. But if this does not work or you have severe relapse, you'll be given IV methylprednisolone 500 milligram for 3 to 5 days, and usually you would require hospital admission. Now, another novel treatment is stem cell treatment known as HSCT. As explained, your immune system mistakenly attacks the myelin thinking it's a foreign agent. So HSCT uses intensive chemotherapy to reset your whole immune system by totally wiping out your immune system as clean, then injecting the stem cells that were collected from your bone marrow back into your body to regrow your immune system. Using your own stem cells as opposed to stem cells from another donor means there is less chance of your own body rejecting the stem cells. HSCT is effective for those who have frequent relapses despite taking your disease-modifying drugs, and if you have an aggressive type of MS. Also, if you're early into MS progression and you do not have any significant disability. So far, the studies for HSCT have been promising, and it has been shown to either slow down or halt the progression of MS. If you do not have any signs of inflammation on MRI, you do not have relapses, or if your MS is advanced, then HSCT is simply not for you. Side effects to consider with these treatments are early menopause, fertility problems, risk of infections, cancers, and also remember that having chemo has its own side effects such as fatigue, nausea, loss of appetite, hair loss, and several other side effects. Let's talk about cannabis treatment for MS. Now, nabiximols, also known as savitex, is a cannabis drug licensed for the treatment of moderate to severe muscle spasticity if treatments like baclofen or Botox have not helped. This is used as a mouth spray that contains both THC and CBD in equal amounts, and the treatment has shown to be 20 to 30% effective. Now, that don't sound like much, but for someone who's got MS, that is quite significant. Usually, you're monitored for up to 4 weeks of a treatment, and savitex is stopped if there is no response after 4 weeks. With savitex, you can expect side effects such as memory or concentration problems, dry mouth, fatigue, dizziness, which usually tends to wear off maybe after a few days. Cannabis has also used for bladder problems in MS, anxiety, depression, insomnia, pain, fatigue. But we know that a lot of people with MS do self-medicate. They either grow or buy their own cannabis, known as street cannabis or recreational cannabis, because savitex is not something that is commonly prescribed for some reason. Now, doctor, how do I know that my treatments are working? And how do I know that my symptoms or disability are getting worse? So one way of knowing this is by using what we call the Expanded Disability Status Scale, also known as EDSS. This scale is used to monitor the level of changes of disability over time, and it ranges from 0 to 10 with 0.5 unit increments, such as 3.5, 4, 4.5, and it's also used to decide who has certain treatments. So if, for example, your score was 5 or 6 and you're now 6.5, this means that you now use a wheelchair, and also you're not eligible for disease-modifying drugs as you have gone past the point where these drugs will have any benefit due to the level of disability. So the higher your score, the higher the level of disability. So the EDSS will look at your walking, bladder or bowel problems, speech, but it does not cover areas like fatigue or mental health or what you class as invincible impairments, so it's not a perfect tool in that sense. And there is a query as to why the EDSS has a great emphasis on walking as a disability. However, the good news about MS is that it is an area that is always under research, new clinical trials, new novel drug treatments, and therapies that were not thought possible or available 20 years ago. People with MS are living for longer and with better quality of life. The most important thing to note is early recognition of symptoms, early diagnosis, and early treatment leads to better prognosis. Now, I hope you all enjoyed this video. Please feel free to share, like, and subscribe.